What is the deep infiltrating endometriosis? What other people may say die. Deep infiltrating endometriosis is an advanced form of endometriosis, a severe form of endometriosis or endometriosis which have actually spread outside the uterine cavity, to the ovaries and so forth. This deep infiltrating endometriosis affect 1% of all women. However, it affects about 20% of patients with endometriosis. What is deep infiltrating endometriosis? I said deep infiltrating endometriosis is an advanced and severe form of endometriosis. It is more severe and harder to treat. Deep infiltrating endometriosis enters the organ that are outside the uterine cavity and usually enter the infiltration depth is about 5 millimeter. These organs, which may be affected by what we call deep infiltrating endometriosis, it may be anterior of the pelvis, commonly the bladder, the uterus itself, which we call adenomyosis most of the time, the bowel itself, it could also infiltrate the bowel on the posterior compartment, the ovaries on the lateral compartment, in that case we call it endometrioma, and even the uterus itself, as I explained, that is called adenomyosis. How to diagnose deep infiltrating endometriosis? How can we diagnose it? Medical history is very important, which they explain to the patient may explain to you about how severe is the pain, how problem with the bladder, problem with bowel action and so forth, and pain during sexual intercourse. Therefore, pelvic examination as well, you may be able to pick up a nodule or enlarged adnexa and even a nodule in the rectum as well. Gynecological ultrasound is very important. Transvaginal ultrasound, in this case, is actually very good to diagnose deep infiltrating endometriosis. And then however, transvaginal ultrasound need a lot of experience and expertise so that you can diagnose this condition. And then most of the time, it's been missed by a lot of gynecologists. That's true because there is no proper training in this line of ultrasound. And ultrasound is most cheap and benign and much more easy instrument actually to use to diagnose endometriosis. And it's not expensive as well. MRI as well, it's also one instrument or modality which can be used to diagnose deep infiltrating endometriosis. It also needs a radiologist got experience as well to interpret the findings. Laparoscopy, it can also be used to diagnose it, but usually in this time when you do a laparoscopic diagnosis of deep infiltrating endometriosis, it can be difficult because you're coming from anterior part and you don't know what's the extent of the lesion, especially if the lesion is in the bladder, especially if the lesion is in the bowel, or even it's on the lateral side where you get the uterus and so forth. Therefore, it's very important to prepare the patient with a proper diagnosis before you can do surgery for deep infiltrating endometriosis. What are the symptoms of deep infiltrating endometriosis? Severe pain, pelvic pain, painful micturition during passing urine, painful menstruation, severe, which we call dysmenorrhea, where the patient actually take 2 weeks or a week at home on pain medication, going through a very severe, distressing pain and misery of this pain, painful intercourse as well, dyspareunia, and painful passing stool, which is dyschezia. These are the typical signs of a deep infiltrating endometriosis and need you to do a proper diagnosis and a proper patient preparation so that you can go on with the diagnosis and actually treatment of this condition. How is deep infiltrating endometriosis treated? It can be treated medically for pain relief, oral contraception, progestogen, and even GnRH analog, even Vesani being a new treatment on the market and doing very well to medically control this condition. Surgical treatment, good preparation of the patient and a proper diagnosis and understanding the extent of the lesion and proper planning of treatment. Laparoscopically, it can be removed and can do laser ablation, and you can do even surgical removal of the whole lesion. What are the complications of deep infiltrating endometriosis? Firstly, because of inflammation and scarring, you can have what is called frozen pelvis and spontaneous bleeding, either from the ovaries, chocolate cyst, or even from utero-ovarian vessels. Therefore, it's a procedure which need meticulous, approach with a good skill of laparoscopy, and then so that you can avoid complications like uteric injury, bowel injury, bladder injury, sepsis, and infection, and fistula formation, which can be formed between the bladder and the vagina, can be formed between the bowel and the vagina itself. And as well, these conditions got high morbidity and mortality. However, to lower this situation or this complication, it's better to do a proper diagnosis and what other experts will say mapping. In other words, to know where the lesion is, the size of the lesion, the extent of the lesion, so that you can know how you can approach and laparoscopically and operate this condition. However, it is the condition which it can be brought under control, and you can take misery out of the patient. Thank you.